Hello, I'm Dr. Fahim Khan. I'm a consultant rheumatologist in the UPMC Ortivan Hospital, Kilkenny, Ireland. And I want to give you a quick talk and update on the medical management of osteoarthritis knees. So first of all, what is osteoarthritis? Osteoarthritis is a normal wear and tear process. So as we age, we tend to develop wear and tear. So let's talk about the osteoarthritis knees. Symptoms of osteoarthritis knees is mostly pain, stiffness. These are the most common symptoms. And of course, some patient could have intrinsic knee problem like locking of the knee, catching of the knee. The knee at times would give way. So osteoarthritis of the knees present with mostly pain in the knees associated with stiffness, and some patients may also notice swelling of the knees. So dealing with osteoarthritis of the knees is medical management, and then of course surgery is the next resort. Medically, as a rheumatologist, we treat osteoarthritis knees first of all with patient education. Most important, simple knee exercises, advice on gradual weight loss if they are overweight, physical therapy or physiotherapy, knee strengthening exercise, and pain relief. So if we talk about the pharmacological therapy for pain relief, we start with simple painkillers like acetaminophen or paracetamol or Tylenol. Occasionally, a low dose of non-steroidal anti-inflammatory medication can be used like ibuprofen. But then we have to be careful, particularly in patients who have kidney problems, that non-steroidal anti-inflammatory medications can cause further problem as regards to kidney problems, or if they have a history of stomach ulcers, then there's a risk of predisposition towards gastric ulcers, bleeding, etc. So they are better to be avoided. So simple painkillers are better. Some patients may need to take medications like tramadol for knee pain. A rheumatological input from the osteoarthritis knee problem is to assess the knee first, look at the knee with x-rays to see whether can be treated medically or surgically, and also to differentiate whether the pain in the knee is coming from simple osteoarthritis wear and tear, or if there is a loose body in the knee, if there is a meniscus tear or ligament tear, and then orthopedic referral can be arranged accordingly. So from the medical management of osteoarthritis knees, if the patients are still symptomatic and they're not at this stage to go for knee replacement surgery or keyhole procedures like arthroscopy, then a corticosteroid injection can be given into the knee. So different types of steroid injections are used. So for example, methylprednisolone or triamcinolone are the first line corticosteroid injection. And they work much more quickly. They start to work after a day or two, but the injection could last for at least a month or so. But it does relieve the pain, and the severe disability from the knee pain is relieved in most of the patients. Sodium hyaluronic acid injections are also given into the knee joints. These are injections which help to prevent further wear and tear of the knee. They're like putting a gel in the knee. And hyaluronic acid is a very important part of the cartilage of the knee. So these injections are supposed to regenerate the cartilage as well. They work as sort of anti-inflammatory for the cartilage. But basically, they are given with steroids or without steroids. The sodium hyaluronic acid injections could take a little bit of time to start working. They're not as fast to work as a corticosteroid injection is, but it also helps the knee from knee pain, stiffness point of view, and the duration of action could be a few months. So these injections can be repeated 3 to 6 months later. I prefer to do them 6 months later if required, rather than but they can be given every 3 months if required. A total of 3 to 4 injections in a knee can be done with a steroid injection. The same applies for a hyaluronic acid injection as well. But of course, and aseptic techniques are used for prevention of knee infection, which unfortunately is a side effect of the knee injections. Occasional patient, less than 5% of patients could have a steroid-induced flare-up after they have a knee injection, which is pain at the site of the injection. Sometimes they develop redness, swelling, and which is normally minimized by the use of ice packs and taking simple painkillers like paracetamol, acetaminophen, Tylenol. But if the pain and swelling persist for more than a day or two, then a review from a rheumatologist should be taken to make sure there's no infection. So once the knee pain has eased off after the acute event of knee pain, then patient advised to start simple knee exercises which are based on developing strength in the knee thigh muscles, which are quadricep muscles. So they're quadricep muscle strengthening exercises. I have all my exercises for the knee pain, are on my website. And if you want to have a look at it, you can have a look at it on www.arthritisandpainclinic.com. And if you go into the website, you go into patient info, scroll it down into exercise, and you can start with simple knee exercises, followed by knee strengthening or quadricep muscle strengthening exercise, which does help. I always advise patients regarding gradual weight loss, losing weight, maintaining ideal body weight, because if you are overweight, there's very high risk towards knee replacement surgery in future. So losing weight is a very important part of the management of osteoarthritis knees. Patients who do not respond to the above mentioned measures, and if they have on x-rays or on clinical examination severe, moderate to severe osteoarthritis knees, they end up having knee replacement surgery. So medically, just to summarize, the treatment for osteoarthritis of the knees is: number one, simple knee exercises followed by quadricep muscle strengthening exercises, gradual weight loss if you are overweight, and taking simple painkillers, which are like acetaminophen, which is called paracetamol, or Tylenol, or occasional tramadol. If required, the knee joints can be injected with a cortisone or a steroid injection, with or without hyaluronic acid injection. Most of the patients, they do very well with this particular regimen. So if you have any question, concern, please get in touch with me on my website, www.arthritisandpainclinic.com, or email me at rheumatologyclinics@gmail.com. Thank you very much. This is Dr. Fahim Khan, consultant rheumatologist at the UPMC Rt1 Hospital in Kilkenny, Ireland. Thank you. Bye-bye.